Every 40 seconds, someone in the United States has a stroke. That means while you're watching this video, dozens of people will experience this life-changing event. But here's what might shock you even more. Most of these strokes could be prevented if people knew what you're about to learn today. I'm here to share 10 facts about stroke that will fundamentally change how you think about your health and the health of everyone you care about. These aren't just statistics from dusty medical journals. These are insights that could literally save your life or the life of someone you love. And I promise you, by the end of this video, you'll never look at certain everyday situations the same way again. Let's start with something that will completely flip your understanding of who's at risk. When most people think about stroke, they picture an elderly person, probably someone in their 70s or 80s. The Centers for Disease Control and Prevention has been tracking stroke statistics for decades, and here's what their data reveals. Strokes in people under 45 have increased by 44% over the past 2 decades. That's not a typo. Nearly half more young adults are having strokes today compared to 20 years ago. Dr. Amelia Boimi from Columbia University published research in the Journal of the American Medical Association showing that 1 in 7 strokes now occurs in young adults. Think about that for a moment. Your colleague who just turned 35, your neighbor who's training for a marathon, your sister who's raising young children, they're all at risk in ways previous generations never were. The reasons behind this trend are both shocking and preventable. The American Heart Association's research points to several culprits that are becoming increasingly common in younger populations. High blood pressure, which used to be primarily a concern for older adults, is now affecting people in their 20s and 30s at alarming rates. This is largely due to processed foods loaded with sodium, sedentary lifestyles, and chronic stress from our always connected digital world. But here's where it gets really interesting, and this is our second shocking fact. Your brain doesn't care how old you are when it comes to recognizing stroke symptoms. The National Institute of Neurological Disorders and Stroke has found that younger stroke victims are significantly more likely to be misdiagnosed in emergency rooms. Why? Because doctors, just like everyone else, associate strokes with older patients. A 30-year-old presenting with dizziness, confusion, or severe headache might be sent home with instructions to rest and take aspirin when they're actually experiencing a medical emergency that requires immediate intervention. This diagnostic delay can be catastrophic. Every minute that passes during a stroke, your brain loses approximately 2 million neurons. The longer the delay, the more permanent the damage. Harvard Medical School researchers have documented cases where young stroke victims suffered irreversible brain damage simply because their age made medical professionals less likely to consider stroke as a possibility. Now, let's talk about something that might make you reconsider your next weekend plans. Our third shocking fact involves activities that millions of people do regularly without a second thought. The American Stroke Association has identified several surprising stroke triggers that most people have never heard of. One of the most unexpected, sudden head movements during certain exercises or activities. Chiropractor visits, for instance, have been linked to a specific type of stroke called vertebral artery dissection. The National Center for Biotechnology Information published a comprehensive study showing that neck manipulations can tear the delicate arteries that supply blood to your brain. While the risk is relatively low, occurring in about 1 in 20,000 treatments, it's significant enough that you should always discuss this risk with your healthcare provider before any neck adjustment. But it's not just chiropractic care. Yoga poses that involve extreme neck extension, certain weightlifting movements, and even activities like painting a ceiling or getting your hair washed at a salon can potentially trigger strokes in susceptible individuals. The key word here is susceptible. Most people can do these activities safely, but if you have underlying risk factors like high blood pressure or a history of migraines, you need to be aware of these potential triggers. Speaking of migraines, here's our fourth shocking fact that connects 2 conditions most people think are completely unrelated. The World Health Organization has published extensive research showing that people who suffer from migraines with aura have double the risk of stroke compared to those without migraines. But here's the truly shocking part. For women under 45 who have migraines with aura and take birth control pills, the stroke risk increases by 8 times. This isn't meant to scare you away from necessary medication, but it highlights the importance of informed decision-making. The American College of Obstetricians and Gynecologists now recommends that women with migraines discuss alternative contraceptive methods with their doctors. There are many effective options available that don't carry this increased stroke risk. The connection between migraines and strokes goes deeper than just statistics. Research published in the New England Journal of Medicine suggests that both conditions involve similar changes in blood vessel function and brain chemistry. Understanding this connection has led to breakthrough treatments that can help prevent both migraines and strokes simultaneously. Our fifth shocking fact will change how you think about sleep, something we all do for roughly a third of our lives. The Sleep Heart Health Study, one of the largest sleep research projects ever conducted, followed thousands of participants for over a decade. Their findings were startling. People with severe sleep apnea have a stroke risk that's nearly 3 times higher than those with normal sleep patterns. Sleep apnea is far more common than most people realize. The National Sleep Foundation estimates that 22 million Americans have sleep apnea, but the vast majority don't know it. They might snore loudly, wake up feeling unrested, or experience daytime fatigue, but they don't realize these symptoms indicate a serious medical condition that's quietly increasing their stroke risk every single night. During sleep apnea episodes, your brain is repeatedly deprived of oxygen. Over time, this damages blood vessels and increases inflammation throughout your cardiovascular system. The American Academy of Sleep Medicine has documented how these nightly oxygen deprivations create the perfect conditions for stroke-causing blood clots to form. The good news is that treating sleep apnea dramatically reduces stroke risk. Continuous positive airway pressure therapy, commonly known as CPAP, has been shown to normalize stroke risk within just a few months of consistent use. If you snore regularly, wake up gasping for air, or feel tired despite getting adequate sleep, talk to your doctor about a sleep study. It could literally save your life. Now, let's discuss something that might be happening in your mouth right now without you realizing it. Our sixth shocking fact connects dental health to stroke risk in ways that would surprise most people. The American Dental Association, working with cardiovascular researchers, has discovered that gum disease significantly increases stroke risk through a mechanism most people would never suspect. When you have gum disease, bacteria from your mouth enter your bloodstream every time you brush your teeth, floss, or even chew food. These bacteria don't just stay in your mouth, they travel throughout your body, including to your brain's blood vessels where they cause inflammation and contribute to the formation of dangerous blood clots. Research published in the Journal of Clinical Periodontology followed over 60,000 people for 15 years and found that those with the most severe gum disease had twice the stroke risk of those with healthy gums. Even more shocking, the researchers found that people who lost the most teeth due to gum disease had nearly triple the stroke risk. This connection explains why some stroke victims have no traditional risk factors like high blood pressure or diabetes, yet still suffer strokes. Their mouths were harboring the bacteria that ultimately caused their brain emergency. The solution is surprisingly simple: excellent dental hygiene, regular professional cleanings, and prompt treatment of any gum problems can significantly reduce your stroke risk. Here's our seventh shocking fact, and this one will make you think twice about how you handle stressful situations. The Interstroke study, published in The Lancet and involving over 13,000 stroke patients from 22 countries, identified acute stress as a major stroke trigger. But it's not just chronic. Long-term stress that's dangerous. Sudden, intense emotional or physical stress can trigger a stroke within hours. The researchers found that experiencing a major stressful event doubles your stroke risk in the following hour. This includes everything from intense arguments and job loss to physical trauma and even extreme joy or excitement. The mechanism involves sudden spikes in blood pressure and heart rate that can rupture weakened blood vessels or dislodge existing blood clots. What makes this particularly shocking is that many stroke victims report feeling perfectly fine before their major stressful event. A healthy 50-year-old might have a heated argument with a family member and suffer a stroke an hour later, despite having no previous symptoms or known risk factors. The stress acted as the final trigger for a stroke process that may have been building silently for years. The Mayo Clinic has developed specific recommendations for managing acute stress to reduce stroke risk. These include deep breathing exercises, immediate removal from stressful situations when possible, and seeking professional help for managing ongoing stress. Learning to recognize and manage your stress response isn't just good for your mental health, it's crucial for preventing strokes. Our eighth shocking fact involves something that happens to millions of people every year. Yet most don't realize its connection to stroke risk. The American Heart Association has published extensive research on how common infections can trigger strokes, particularly in people who already have underlying risk factors. Respiratory infections like pneumonia or severe cases of flu increase stroke risk by up to 3 times in the weeks following the infection. The mechanism involves widespread inflammation that affects blood vessel function throughout the body, including the delicate vessels that supply your brain. Urinary tract infections, particularly severe ones, can have similar effects. Even dental infections that seem minor can have major consequences. The Journal of Stroke published a case study of a 42-year-old man who suffered a massive stroke 3 days after a routine dental procedure became infected. The bacteria from his infected tooth socket traveled through his bloodstream and caused a clot in his brain's main artery. This doesn't mean you should avoid necessary medical procedures or live in fear of every infection. Rather, it highlights the importance of taking infections seriously, seeking prompt treatment, and being aware of stroke symptoms in the weeks following any significant illness. Your immune system's response to infection can have consequences far beyond the original problem. Here's our 9th shocking fact, and this one challenges everything most people believe about stroke prevention. The Women's Health Study, published in the New England Journal of Medicine and following nearly 40,000 women for over a decade, made a discovery that surprised even the researchers: low-dose aspirin. Long recommended for heart attack prevention, actually increases stroke risk in women under 65. For years, doctors routinely prescribed daily aspirin for both men and women as a preventive measure against cardiovascular events. But the research revealed that while aspirin reduces heart attack risk in both sexes, it has different effects on stroke risk depending on your age and gender. In younger women, the blood-thinning effects of aspirin actually increase the risk of hemorrhagic stroke, where blood vessels in the brain rupture and bleed. This finding has revolutionized how doctors approach stroke prevention. The American College of Cardiology now provides gender and age-specific guidelines for aspirin use. What's right for a 60-year-old man might be dangerous for a 40-year-old woman. This is why you should never start or stop taking aspirin for stroke prevention without consulting your doctor first. The research also revealed that the benefits and risks of aspirin change as you age. Women over 65 actually do benefit from low-dose aspirin for stroke prevention, but the timing of when to start is crucial. Getting this decision wrong can literally be the difference between preventing a stroke and causing one. Finally, our 10th and perhaps most shocking fact will change how you think about stroke recovery and the brain's incredible ability to heal itself. The National Institute of Neurological Disorders and Stroke has documented cases that defy everything we thought we knew about brain damage and recovery. Traditional medical thinking held that brain cells, once damaged by stroke, could never regenerate. Patients were told that whatever function they lost in the first few months after their stroke would be permanently gone. But groundbreaking research using advanced brain imaging has revealed that the adult brain possesses remarkable healing capabilities that we're only beginning to understand. Dr. Alvaro Pascual-León from Harvard Medical School has published studies showing that stroke survivors can regain significant function even years after their initial injury. The key lies in intensive, targeted rehabilitation that literally rewires the brain. Healthy brain regions can learn to take over functions previously performed by damaged areas, but only with the right kind of stimulation and practice. Even more shocking, research published in the journal Nature has shown that the brain continues producing new neurons throughout life, even in areas previously thought to be fixed and unchanging. Stroke survivors who engage in specific types of cognitive and physical therapy can actually grow new brain connections that bypass damaged areas. This research has led to revolutionary new treatments, including virtual reality therapy, brain stimulation techniques, and intensive constraint-induced movement therapy. Patients who were told they would never walk again are not only walking, but running marathons. People who lost their ability to speak are giving speeches about their recovery. The implications extend far beyond stroke recovery. This research suggests that many neurological conditions once considered hopeless might be treatable with the right approaches. The key is starting intensive rehabilitation as early as possible and never giving up on the brain's ability to adapt and heal. What makes all of this information even more powerful is that it puts control back in your hands. Every single risk factor we've discussed, from gum disease to sleep apnea, from stress management to infection prevention, is something you can address starting today. You don't need expensive treatments or complicated procedures. You need knowledge, awareness, and the commitment to take action. The most shocking fact of all might be this. Despite strokes being largely preventable, most people remain unaware of these risk factors until it's too late. But now you're different. You have information that most people don't. You understand connections between seemingly unrelated aspects of health that could save your life or the life of someone you care about. Remember that stroke is not just an older person's disease. It's not something that happens to other people. With the trends we're seeing in younger populations, everyone needs to be aware, everyone needs to be prepared, and everyone needs to take action. The brain you save might be your own, but the knowledge you share could save countless others. Take this information seriously, but don't let it overwhelm you. Use it as motivation to make positive changes, to have important conversations with your healthcare providers, and to be more aware of the warning signs that your body might be trying to tell you something important. Your brain is remarkably resilient, but it's also counting on you to give it the best possible chance to stay healthy throughout your life.